Hello, everyone. We're live. I have my good friend, Vanessa Moldovan, on today. We're going to talk about stopping revenue leakage. I'm excited, guys. There's nobody better that I know, to talk about this because, Vanessa, you are the host of the podcast for the Love of the Revenue Cycle. So welcome to the show.
Thank you so much. Thank you. I'm so excited to be here. Love this topic.
Yes. And, I have my normal podcast every Thursday, guys, but we're doing a special kind of boost right now for our speakers for the upcoming Practice Management Symposium on February 16th. So we're inviting all of our people on to talk about their session and really why we're doing this, because we feel that it's so important to have this discussion for you practice managers out there and those of you interested in becoming practice managers. We're always telling everyone, there's a lot to do in healthcare and there's a lot more than just coding, right? I feel like if we have these different hats we wear, right? And we're like, I want to be a coder, I want to be a biller. And that's our kind of tunnel vision, right? But there's so much more to do. And we get so frustrated with the process of, the way things are done. And maybe you want to change things. You can change things at a different level, maybe. So maybe you decide you want to go into practice management, right?
Yeah. And I also think that even as a biller, as entry level or, not as non-management, whatever you want to say, as a line worker, you can make a difference too. And I think that understanding your impact as the person doing the work, obviously the manager has the, decision making and has the oversight and such, but the line workers are the ones in there doing the work, and they certainly can make a difference and benefit from this conversation of how the decisions they make every day, the phone calls that they make to the payers, the research they do on the denials, all of that is contributing to, preventing the revenue leakage. So they certainly have, impact whether they're in a management role or not.
Exactly. I find it just being so frustrating when I hear people talk about they can't get things done because they have this rule or this regulation from a employer, and it's not really a government regulation. It's just a policy, right? They have in their office and different things, and you wonder where it comes from. And somebody years ago said we're going to do it this way.
Yes.
And then that next person says, okay, well, I was told to do it this way. And then it's like a vicious cycle, right? And it's crazy. Here we are. Why do you think, Vanessa, right now, like these last couple of years, why do you think it's so much more in our face about denials and everything? Like it seems like we've been hearing this for a long time, but people are paying attention now because we see so much going on. So what do you think is the reason?
Well, I think one of the biggest catalysts has been staffing shortages. Since the pandemic, lots of people made a decision not to go back into the workforce, or they said, I'll go back, but I want to be remote. They're choosing quality of life, time with their families, over the 80-hour-a-week job, which unfortunately in this field, a lot of us work very long weeks, and many, many hours a day in order to keep everything going. So I think that was probably the first catalyst, is this, staffing shortage that's going on. And so then what's happening is everyone's scrambling to keep things going, keep the revenue coming in, but you have less people. So now you have to have people who have, their training, has to be really elite, and they have to be, really experts and very efficient, very effective, because they're, working with less people. Then we run into that lack of standardization you and I were talking about the other day, right? There isn't a school, some traditional school that we can walk into and learn how is the best way to run a revenue cycle. There just isn't one, as of right now, there is not one. I'm hoping to change that, in the future, but I think that definitely adds to it. And so we're going back to, but it takes time. So when you're networking, when you are, doing what we have done for so long, reaching out, how did you do it this way? How did you do it that way? And then that's also where we run back into like what you were saying, where, you learned it this way, but somebody else told someone 10 years ago, this is how we're going to do it. It's that lack of standardization, where somebody was like, and there are some, definitely nuances to the revenue cycle there. It's not, coding has guidelines, right? It has definite guidelines. You have a lane that you have to stay in, and billing has some lanes that you stay in. But other than that, because of specialties and geographic areas and other, elements there, there are nuances that from one, practice to another, even sometimes. So I think that's why we are where we are today, where we just have this need to learn how to work denials, and not only that, prevent them, Jennifer. I think that is really where, that's where I put my focus. So first, I want to teach you to be an expert in reversing your denial and resolving your denials, but then let's stop. And that's where we need to talk to the decision makers, right, who are in charge of operations, and say, hey, we need to prevent these suckers. Like, for years, there's been that for years. And I'm sure you heard this. There's those arguments of, well, preventing the fire or putting the fire out, right? Well, now we cannot have this conversation anymore. It is definitely, we have to prevent these fires. It's just not working to just put them out.
No, yeah. I mean, you can put fires out all day long, but you're not getting anything done. You're not being productive. And I feel like, I'm sure you'll talk about this, the standard, just slap a 59 on it, just put a 25 on it.
Oh my gosh.
I guess I don't know where that came from, but obviously it comes from the payers, because they have these rules. They say, oh, well, this will get it paid. Or they'll say you're missing a modifier. So somewhere down the line, someone said, we're missing a modifier. Let's figure out which one. So the payers have to need a modifier. So we had to put a modifier on, and that's the way it's going to work. But no one ever gave any thought to, does the documentation support that modifier?
Right. Yeah.
So I mean, the payer wants it, but should it be there?
Yeah, exactly. And isn't that an age-old argument? But it's more and more, becoming more prevalent of, the payer guidelines versus the coding guidelines, right? And the documentation, and and sometimes it is, well, the payer requires it in this scenario, even though, especially modifier 25, right? It's a payer requirement, and even though we know per that modifier definition, the documentation doesn't necessarily support telling that story, right? And it's a big challenge. And I think that is our, when we think about winning a war, we have these battles we're winning, but when we think about winning a war, that's the war that we're really, trying to win, is with these payers, is like, being respectful of, there are compliance guidelines that need to be followed. And it isn't just about getting dollars paid and in the bank or denying things that, it isn't just about that. It's number one about patience, right? And number two, we have to be compliant. Did we actually perform those services? Are we representing it well in what we're billing? And not forcing these uncomfortable conversations of having to choose, ethical, non-ethical. I mean, it's super uncomfortable. And then, people are trying to keep their doors open, right, and pay their bills. And it's a big challenge. And I agree with you. I think that it stems from the challenges the payers have put in front of us to get payer reimbursement guidelines. I mean, it's just so challenging to meet all of those guidelines, and to keep the revenue in, and to keep staffing, and to, it has definitely come to a head in this day and age, right? We feel it so much in the industry.
We do. And, I have had managers who have been very much like letting us look at the payer policies. Like they're like, we don't want it to go out wrong, so take the extra time. Then I've had those who are like, it's month end, I don't care, get it out. But my question is, okay, like say you have 100 claims, right? Let's say 25 to 50 of them can be put out there. Maybe there's 10 to 15 or so that need to be weighted. You need to wait on them. Are you really going to lose that much revenue by waiting a day or two for some information when you have a substantial amount that's ready to go out the door?
Right.
What is it going to hurt, right? But in a hospital setting, I know RVUs, it's a big deal. Physicians are paid on RVUs. I understand.
Sure.
So you can there's ways to at least get your physicians paid for the work they did. But again, you're going to adjust it the next month. Like say that the codes change, it just gets adjusted. That was my job actually for a while. I had to read the variance reports and advise on, of course, whether or not they should be added or taken away and things like that. So there's people behind the scenes that do that. So it's not going to hurt long term. Your organization from waiting to get the charges out, getting them done right.
Yeah, absolutely.
It's just a mess. Yeah.
And I think that, and this is where what we do make such a difference is, education is power, right? And many of the people who are making big financial decisions, right? They just don't have the knowledge that we do around these guidelines and compliance. And so it's tough for them, right? They are hired to, bring a certain amount of money in, right? They're hired to get those RVUs, and they're hired to do budgeting, and they're hired to do all that. And never in those conversations is, oh, by the way, you have to be concerned about this thing called billing. You have to, pay attention to these guidelines called billing, which, like, what are you talking about? And so I think that, there really is a part of it where it's like, I don't really blame those decision makers. I feel in a way they're set up to fail because they're not given the entire story. And that is where, we come in with our expertise and hopefully, and that is the message I hope to get out is, we're not judging you, but we do ask that you listen, stop for a moment, listen to what we're saying, and learn about this aspect of the financial side, right? The business side of healthcare. And let's do it right the first time, like you were saying, right? If we have to hold the charges, we have to hold the charges, and this is the reason why we're not making this stuff up,
Exactly. And, at some point, it's very possible and very likely you're going to get an audit. And if you are following your compliance program, you're already doing those audits. There's red flags out there. So for instance, if you're already an outlier, if you are a large practice anyway, like you're already on the radar because you submit so many charges. And then you add in the amount of modifier 25s you put on. You add the amount of modifier 59s you put on. Every time that happens, you're being tracked. So why would you add the risk to being more on their radar by just doing what, of course, on the next podcast, we're going to talk about creative billing concepts. Some of these creative things that people are doing, they call creative, we call fraud.
Exactly. Exactly.
Yeah, it would be nice if it'd be nice. And I'm going to share with our audience, Mrs. Pam Vanderbilt, who we all know and love, made a nice comment or a nice question here. Wouldn't it be nice if all healthcare plans had to follow a single set of policies? Oh my.
Wouldn't standardization be wonderful? Yes, I agree, Pam. It would be wonderful.
And that's the thing in society. Everyone has to agree on what is correct, right? And when's the last time you got 10 people in a room, they all had the same thought, I mean, it's like we're all individuals, we're all thinking independently. We're not thinking, about the patient a lot of times. Not much, and everyone's not. But those who are thinking financially, viability of the organization, unfortunately, a lot of times their mind is not going towards individual patients that are affected. They're going by numbers. They're numbers people. Like this is the name of the game. Numbers don't lie. True. It's true. But the numbers are also telling us you have staff members who are untrained. And I can tell the minute I go into a practice, I don't even do an audit yet. The first thing I do is I say, let me see your data for the last 6 months. And I'm looking for trends, right? I'm like, I don't have to do an audit. I can tell you right now where your problem is. Because I know your code set.
It's so true. And it's the challenging when we're talking about the standardization, that becomes a challenge too. And I think for those of us like you and I, in this field, those who hire individuals like us to come in and help them out, I think it can be difficult for them too, because they're like, oh, well, I talked to so-and-so and they said, do it this way. And it's not that your way and your recommendations are wrong or mine are wrong, but because of that lack of standardization, we just have figured out a different way to do it. And so again, that sets up like this, mistrust, unfortunately, and when we're trying to, give these recommendations. So I think that plugging along, like how you're having this, symposium, bringing in these leaders, bringing in these decision makers, and also those, who are on the front lines and doing the work, and bringing in, thought leaders, and all of our, perspectives and ways that have worked in the past. These are our, recommendations that have definitely worked and will keep you out of an audit, keep you, out of trouble. And not only that, but will keep your revenue going and keep that flow, like we were talking about, right? Preventing that leakage. And the other thing I want to say, and I'll be including this, on the during the symposium, but it's a lot of tough decisions. It's tough decisions to prevent leakage, because you got to have some pain up here in the front, a little bit of pain in order to reap the benefits on the end, sometimes, and having those difficult conversations with those decision makers, who hold the purse strings. But persevering will pay off in your practice and in your organization.
100%. It's never fun to wait for money. Like, there are times where I'm just like, gosh, I need that check today. I'm expecting this. I'm like, I have bills to pay. I understand the feelings. I know what it's like. But patience is a great quality to have in life and in business, because like for me, for instance, I started my own business again back in June of last year. And it was kind of stressful at first, but I just persevered. This is what I really wanted to do. I wanted to be able to make my own decisions and drive change on my own. And it took me a little bit. We had one client we're waiting on, and we waited till December, right? They like really just hung on there, and it paid off in the end. Like, the patience was worth it, because now I am able to, use a lot of that, experience I had to drive me forward. I learned a lot from that patience I had. And so same thing with the revenue cycle, or revenue leakage, as we're talking about. You can stop a lot of these leaks internally. Like, there's a lot of things people don't know. And I am just shocked when I see, not LinkedIn, for instance, but there's other social media groups where I see people post things, and I'm like, why aren't your managers teaching you these things? You're out here on Facebook asking questions about very basic things that you should have been trained on, and things you shouldn't even put out there on social media, for instance. And where are these managers controlling their staff? And a lot of it's remote. You can't control people remotely, but again, there needs to be some accountability. I'm flabbergasted when I see some of the questions out there that should not be asked on social media. They should be asked to your supervisor.
Yeah, but and the thing is, it's just so challenging, Jennifer, and I know you know this, but it's like, if I'm sitting in that chair and I'm trying to figure out, I've been promoted, and the person I report to, they're not familiar with what I do, right? They just promoted me because I was productive, or people liked me, or whatever, but they still don't really know what exactly does that billing manager, office manager, what exactly do they do? And so I'm sitting there and I'm wondering, is this accountable or not, right? I go out on Google, I search all of these things. I hate to come back to it, but I'm just going to keep coming back. There just isn't that standardization. So I think that one of the things that we have added to our mission, and many of our colleagues and our peers, is providing resources. This is where we recommend, these are solid references and solid resources for you to go to, places that are non-public, where you can answer that question. Is it compliant? Is it, because we know there's a lack of resources on to help you make that decision and to know, is it the right thing to do? So, I'm hoping, by the end of that, 8-hour symposium with all these amazing speakers and stuff, that will provide these people with the resources that they need to feel confident in the decisions that they're making.
Exactly. And that's what it's all about. We want you to feel confident. We have industry leaders that are going to be speaking on topics because they work in organizations that are successful, and they want to pass on that success to you. And the years of experience we have, most of the people on these panels and these speakers have at least 20 years experience, right? I'm probably the baby of the group, honestly, because I've been in it 20 years. Most people have been doing it longer than me. So, I feel like I have a lot to learn yet myself, but I am putting myself out there. I love creating these events. I've been putting on virtual events since 2020, since the pandemic. And I've had people like Kimberly Jolivet Williams, Pam Vanderbilt, Terry Fletcher, Sean Weiss.
Mm-hmm.
I've had Christine Hall, of course. I mean, the list goes on. And I'm just like, and I finally got you to come on, and I'm so excited. I got Maya Turner. I've got Bertram Lantico. I've got Susan Wahlberg, JD. So she's a lawyer. She's an author. She's an amazing woman. And I got to know her. She was on my podcast, the last podcast I hosted. And she's just amazing. And compliance, she wrote the book on compliance. Like she literally wrote the book on compliance.
Nice.
And she actually writes fiction novels on compliance that are pretty fun to read. Yeah. Some like really like crazy stories, but like it really makes you think about compliance when you read some of her novels. It's just, she's such a great writer.
Yeah.
But she's a lawyer, and she has done compliance for big organizations. And so she's a great wealth of knowledge. We're going to interview her on our panel, as well as Terry Fletcher. We're going to have such a wealth of knowledge. And I feel like the cost is low. You know, you get CEUs. It's actually 20% off right now, guys. So if you head over to practicemanagement24.com, you'll be able to buy your tickets. And we'll also be posting it everywhere on LinkedIn, all over social media where you follow Healthcare Inspired, follow For the Love of the Revenue Cycle. We're going to be blasting this everywhere so you can't unsee it.
Because and share it with everyone. Like we were saying in the beginning, you know, it's not just for practice managers, even though that's in the title. You know, we started, you and I both started out sitting in a, frontline seat as well. And we made a difference where we were and soaking up everything that, we could get as well. So, the information and the resources that you'll get even, as a biller or a coder or whatever will be very valuable. So I definitely encourage you. These are some great, as you said, great leaders in the industry with great information. Very exciting.
Yeah. And, our goal was to give everyone an opportunity to learn from people that maybe they've never been able to see live before, or like every aspect of practice management is important. And I think I've been in the role of leadership in a practice before. And so I remember all the things you had to do. You had to pay attention to HR. You had to pay attention to marketing and branding. Man, if you hit the wrong person on social media just blasting you, it can really affect your business and your brand. And so a lot of people don't think about the branding and the marketing aspect of practice management. So Maya Turner is going to help us with that. And, myself, I pick a topic that I think that I'm passionate about is team engagement. I feel like there's a lot to be said about engaging your team and being a person, like a leader that they want to follow, that they want to do their job right because they know you're the one doing it as well. Like they respect you and you engage your team. What do you think's right? What do you think we should do here? Like I, as a person, I don't know everything. Like if I was a practice manager and all I had was comptroller experience, or all I had was experience in finance, and maybe I'm not really great, I don't understand a thing about billing and coding. Guess who I'm going to go to? I'm going to go to the billers and coders and say, hey, tell me what we need to get done, because this has to happen, but how do we get there? Let's talk about it. Involve the team. When you pick an EMR software, do you involve your team? Half the time they just pick one and hope everyone figures it out.
Yeah. Involving them is so important in buy-in, and there's so many decisions that have to be made and change that happens all the time. Right. And so having that buy-in of your team is so important. And one of the number one ways we can do that is involving them as much as possible in decision-making and even little decisions like who's going to have what work list, right? Who's going to have certain, responsibilities. Just that makes such a difference. Because I remember being in that seat and having people tell me, now we're going to be doing it this way. And it's like, do you even know what impact that is going to have on my world? So to involve them and get their opinion on it, I completely agree. And I love that is your passion, the leadership, because I think so many really great employees and great productive, good coders and excellent billers, and they get promoted into these leadership positions based on that productivity and the quality of their work, but are not given the tools and resources they need to be great leaders.
Exactly. And, practice management is not for everyone. So I always encourage organizations to really think with the people in leadership roles, is it really for them? Because you can't be quiet and reserved and you have to speak up. And so I've seen it where you have people that the front staff, the back office, they just walk all over those practice managers, and they do not know how to handle it because they are just like, I can't handle this right now. And they can't make decisions because everyone's doing their own thing. It's chaos, right? So recently I went into a practice and I had to make some tough decisions for them and say, hey, this is my recommendation, and they're following it. But at the same time, it's not easy to kind of rock people's worlds and kind of reshift everyone around, because that's what I do. I know where people fit well because I've been in many different practices. I love helping people figure out where they belong.
And I love it. Sorry to interrupt. I'm sorry.
You're good. Go ahead.
It reminds me of one time in my career, a thought I have about getting people into the right position. I was hired into this position, and within a couple of months, I just knew I wasn't right for it. And I went to a mentor, like, how am I going to do this? Because I have a rule where I stay at place at least a year. It takes a year to really get adjusted and really know, kind of shift. And it was like within 2 months, I was like, oh my gosh, I think I really made a mistake. And I'm not benefiting them. Like, I'm not helping this organization either, because I'm just not the best fit. And the person said to me, you know what, if you stay in that position, you're also someone else who is meant to be in there. You're keeping them from that opportunity. And that just really helped change my perspective. Like, it isn't just about me, right? It's also about the person who really is a great fit for that role. And you know what? That person has been there for 10 years, the one who came in and took my place, so I just really appreciate that perspective too, Jennifer, that, it's so important to put people, a great fit, and understanding how so much of our identity is in our work and in the in what we get out of our work, the joy that we get, the satisfaction that we get out of it. And that comes from a right fit.
It is. And when I go in and I do compliance reviews, the one thing I'm asking is like, one thing I think is really missing is the code of conduct. I don't think a lot of practices pay attention to how their employees treat each other, how they treat management as a violation of the code of conduct. Or if you don't have a code of conduct policy, guess what? It's kind of important. And people think of compliance as all revenue and, fraud and all that. Compliance is more than just the financial part. It's complying with building codes. It's complying with, of course, the code of conduct. And so there's so much to it. And I think practice managers really, really need this conference to remind them of what they do and why it's so important.
Yeah, I agree. So who are the, did you go through all of the different segments that are going to be,
So I did not. I'm sorry. No, I have not. So let's go down the list. So yes. Okay. So we're going to start the day out with HR. We have Bertram Lansico. He's amazing, talent scout, I guess, extraordinaire. Like, he knows coding and billing. He knows recruitment. He's a great resource. And I've been connected with him for about 10 years now. And off and on, we've kind of watched each other as our careers have grown. And so we often connect and we talk about how when we met each other, where we were in our careers and now where we are. And it's just kind of, it's nice to see the growth and the people that you have been following and connecting with over the years. And then we have Rhonda Buckholz, who is our keynote speaker. And I'm so excited. So she's really just going to talk about the future of practice management, where we are, where we've come from, and how serious it is that we get this right. And that we get the, nail the hammer down. We have to throw the hammer down and we have to make decisions. How do we do that? Right. Because it's the difference between staying open or closing our doors at this point in time. Because we know not just offices, but hospitals are closing, closing their doors. And that's just a world I never thought I would see. A community service that, we need. And before you know it, you have these communities. Now in Arkansas, the county I'm in is pretty wealthy. Like, we're in Northwest Arkansas, Walmart and Tyson and JB Hunt Trucking, they're all kind of here. And so we have a lot of money in this area, but other counties are very poor. And so if these rural communities have hospitals closing, those are people that can't afford to get to the next hospital. There's one community where if their hospital closes, they are forced to go an hour away to another hospital, or Branson, Missouri, which is like maybe 30 minutes or so. But it's still, it's not it's not viable for them. And some patients are not going to be able to do that. And if the offices that are employed by the hospital are also part of that organization, guess what's going to happen to them? If the hospital closes, right?
Wow.
So it's a huge problem for the community. So, you know, we got to do something.
I also like, you know, today our conversation was, you know, about revenue leakage. And I like how you're tying in that even though it's HR, it doesn't feel like there's a direct tie to revenue, but there is. Who you hire, like what we were saying, who you hire, putting the right person in the right place, in the right seat, you know, that also can lead to revenue leakage if you got the wrong people in the wrong seat. So protecting your revenue is across the board in all of the practice and the organization.
Exactly. Then we have Maya Turner going to be talking about marketing and branding, like I mentioned previously. And then we'll have our compliance panel with myself, Terry Fletcher, and Miss Susan Wahlberg, the attorney that I mentioned earlier. Very excited about that. So I'm so excited for that, actually, to talk to them because they have serious insights. And unfortunately, Miss Christine Hall is going to be out of town, and we were hoping to grab her, but we are going to grab her for a special bonus webinar you'll be able to download at the conference on compliance and telehealth. So we didn't leave off telehealth. We are going to have Miss Christine Hall to give us a whole discussion on that. So we're very excited to still be able to have her voice at the conference, even though she won't be there live with us. And then of course we have myself talking about, I have 2 sessions actually. I'll be talking about, of course, like I mentioned, team engagement. And then I'll be talking real about financial planning at the end, like just really looking at the models, forecasting, you know, for the next year. You know, what are the things you have to look at? I mean, you're going to be talking a lot about revenue, but I really want to close the conference down with just kind of like a futuristic look at what you could be up against if you don't make changes. So when we look at the changes in the Medicare physician fee schedule from 23 to 24, or the consistent decline in reimbursement by payers, the contracts that we're seeing being ignored. And if people don't realize how many organizations are literally deciding not to go into contract with insurance companies because of the cost what they're losing. So they're basically okay with charging the patient, you know, whatever they want, because they're not going to risk losing money for a payer contract they can't take. So it's going to affect you. We're going to talk about contract management. We're going to talk about credentialing, just all the things you have to know when you're thinking about forecasting for the future, your costs, your budgeting, all of that.
Yeah, that's interesting you bring that up, because when I talk about denial prevention, one of the things that I add in there is, unfortunately, I've been in too many situations where you have all these great ideas of how you want to make these improvements in your practice, and then you forget to like financially plan for that. So to get a better EMR system, to get software, you know, that has some automation, that's going to, you know, bring some efficiency to your practice, like that stuff costs money. And, you know, and training for your teams, and publications, you know, subscriptions to publications so they can do their jobs with compliance and, you know, to you know, optimum status. It takes money to do that. And so planning for that is really important, so that when you're reviewing all of your denials and you're looking at your data and you're like, okay, we got to squeeze here and we got to do these things here. Oftentimes that takes money. Paying your people more so that you can get, you know, better quality individuals with more expertise, as they should be paid for the quality of the work that they do, you know, planning for all of that. So I love that you're adding the financial planning. I think that's something that's often forgotten.
It is. And I saved one of my favorites for last, because it's Jessica Miller. It's AI. And I love listening to her speak on AI at HealthCon and different places. And, you know, she is a great wealth of knowledge on this topic. We have so much noise out there. Just kind of what I call echoes, which is why I call my latest season of the podcast Healthcare Echoes, because we're hearing echoes behind us all over the place. And we're like, should we go over here? Should we go over here? Where's it coming from? Right. But it's just all static, and nobody is really paying attention to the technology itself. What it is, this buzzword, AI, artificial intelligence. You know, that's a broad term, we know, and we know that machine learning is really what we're looking at. But it can't be used in all areas of healthcare at this point in time. And we're just kind of at kind of like, I guess you could say we're just kind of stuck in the mud and we're not moving and we're not realizing the impact it's going to have. And we want to stay in the past. We don't want to get a patient portal. We don't want to do this new technology that's coming. It's coming whether you like it or not.
Yeah. And yes, definitely. And I think that this age old, you know, I've been doing this almost 30 years now, and it's, you know, how long HIPAA started in 1996, and we're still have practices that are not wanting to comply to HIPAA and some of the changes with EDI. And, you know, literally there's still some people in the United States in 2024 working with paper, you know, so this real resistance to change in healthcare. And I think that it stems from, again, it's like no judgment, you know, but it stems from trying things, getting burned, and having to step back, right? Because when we talk about revenue leakage, like, we know one little thing goes wrong, right? You get the wrong person in there, right? Who makes coding errors. Now you owe $1 million to, you know, Medicare. You know, one little thing can really ruin you, you know, financially. So it's a big risk to make some of these changes. And as time has shown, you know, these little people want to be innovative and they want to open, you know, some company, and they sell you some great software, and then it ruins your, you know, company. You're not going to be open to it when it comes up again in 20 years. So it's like, you know, I get it, but I just really feel like now it's like we really have to make these tough decisions. Like you said, it cannot be ignored. Automation, technology, and humans are never going to, well, I shouldn't say never, probably in my lifetime, humans are not going to be taken out of this process, right? It's healthcare, it's care for people. People still have to be involved. You can automate a lot of the revenue cycle. There's still going to be that decision making that has to be made, especially if payers still exist with all of their, you know, their guidelines. But we need the help. We need the help. And so being open to those changes is so important.
Yeah, and you mentioned earlier staffing shortages. That's one of the main reasons why technology is so important right now, because we don't want it to take the place of someone's job, but we just want you to think about the efficiency that it can have. And like we said, find the right person for the right role. So if you're doing check-in right now, or if you're having all these phone calls from patients asking when their appointment is, and you don't have a patient portal, you know how much time you're wasting?
Yeah.
You could be doing other things that are way more important than answering a patient's question about when their appointment is.
Yeah.
You know, that's a simple example, but yeah.
I know. I just got a bill the other day, and the only way I could pay it was mailing in my payment. And I was just like, unbelievable to me. I'm in 2023. There's no website for me to go and pay this payment. I have to mail in my payment. I mean, it was just blew my mind. I told the practice recently, I said, you know, you have all these collections that you have to get to, these small balances, these copay payments that were never collected. And I'm just like, you don't have a patient portal. There's a reason why you're not getting paid, because everyone, I just hate the mail. I know. Because I was scrambling where my stamps were, you know, it's like.
Yeah. I'm like, give me my phone. I have my GPay always on.
Right.
And I'm just like, I have it already ready to go. Pay. I buy everything online. So
yeah. So I think that's a great conversation too. I'm excited to hear, you know, Jessica's presentation, because the whole idea of helping those decision makers with change, you know, and being open to that change. And yes, there's risk involved, but there's always risk involved. But on this path that you're currently on, it is a destructive path. Like, it is not going to, you know, you're not going to be fruitful and profitable without accepting the technology. And like you said, you're just going to sit there with all these uncollected, you know, payments, because more and more of our society is like, if you send it to me on my phone, I'll pay for it. If you don't, I'm not paying for it. You know, more and more, it's just, it's inevitable. So helping with understanding that necessity, so it's a little bit easier to make that decision, because it is scary for some, you know, people. I think that's really important conversation.
Yeah. And, you know, I've always been, my whole life, I thought, okay, when I started down this road, I'd be a coder forever. And I love coding, but I've gone past it now. Like I want to help at a higher level. And I try to help people think that if you're a coder, a biller, auditor, or whatever, you're just a piece of the cog, right? You're a piece of that wheel, and you're all important. But the wheel itself has to keep turning.
Yes.
And if somebody breaks rank and decides to jump off, we have a broken wheel.
Yeah.
That won't turn.
For sure. That's why it's called a cycle, right?
Yeah,
And that's
exactly.
why that is why I love it too, you know, and I also love how it promotes community. You know, it promotes, you know, no one is less important than another person, even though their salary may be different, their level of education may be different. There's literally no one, your HR in person is not more important than your budgeting person, than more important than your coder, more important. No one is more important than anybody else, even the physicians, even the clinicians, you know, for it to all work, for patients to be treated and for money to get in the bank. We all have to work together. And I love that. I love how it promotes, you know, community.
I 100% agree. That's a great way to end the show, guys. So let's think about the community that we have, that we've built over the years. Let's think about where we are now, where we want to go. But always think about how every decision you make will support or break your organization. So we hope to see you at the conference, February 16th, 2024. Vanessa will be there talking about revenue cycle, talking about collections and the front office and how that all goes along with what needs to happen, the revenue cycle. So thank you, Vanessa, for coming on today. And we look forward to sharing this more with our audience.
Yes. Thank you. Thanks a lot. Have a great day, everyone.
We'll see you later. Bye.